The heart has four chambers: the right atrium, right ventricle, left atrium, and left ventricle. The left and right sides of the heart are separated by a membrane called the septum. The atria, or upper chambers, are separated from the ventricles, or lower chambers, by valves. Valves also separate heart chambers from blood vessels. The left ventricle is the most powerful chamber. It opens to receive oxygenated blood from the left atrium and closes to pump the blood through the aorta, a large artery that conducts blood on the beginning of its journey throughout the entire body. The mitral valve, so called because of its resemblance to bishop's hat or mitre, separates the left atrium from the left ventricle. The aortic valve separates the left ventricle from the aorta. The mitral valve closes when the left ventricle contracts. Closing of the mitral valve keeps blood from going the wrong way from the left ventricle back up to the left atrium. The aortic valve opens when the left ventricle contracts, allowing blood to flow to the aorta. When the aortic valve is unable to open freely, blood can back up into the left ventricle and cause heart failure. When the mitral valve does not open fully, blood can back up into the left atrium and lungs. In May 2015, the medical journal Metabolism reported a study from the Azienda Ospedale Universitario Integrato of Verona, Italy, and several other research centers. Non-alcoholic fatty liver disease and heart disease are two complications of type 2 diabetes. Investigators carried out a study to learn whether the two were connected. This study included 247 people diagnosed with type 2 diabetes. It was found the participants with non-alcoholic fatty liver disease had 2.7 times the rate of valve problems of those with normal livers. From these results, it was concluded liver disease was strongly associated with heart valve disease in type 2 diabetic patients. As the name implies, non-alcoholic fatty liver disease describes too much fat in the liver in people not addicted to alcohol. It can cause inflammation and scarring in the liver. In most cases, it does not cause signs and symptoms. Some people notice they have pain in the abdomen on the right side, below the ribs, and unexplained weight loss, which should be reported as soon as possible to the sufferer's doctor. Maintaining healthy weight and preventing or controlling type 2 diabetes can help to prevent non-alcoholic liver disease.